you are a physique scientist, as you like to call yourself. Explain a little bit about what that is.
Yeah, so thank you for the invitation to be on your podcast. This is a special treat for me. I'm an exercise physiologist.
Mm-hmm.
What most exercise physiologists do is they study exercise, sometimes to help with people's health, sometimes for cancer reasons, to help with blood pressure. I'm an exercise physiologist who really takes this knowledge base and applies it to the vanity side of our profession.
Mm-hmm.
So particularly the physique enhancement side. So I study exercise and nutrition and dietary supplements and what the best combination of those things are to optimize one's physique. So the research that I do, I like to say that it helps people optimize their physiques within a maintainable lifestyle.
Mm-hmm. And that's an interesting point, because maintainable is huge there. As a lot of people see these covers of magazines, or when we actually had magazines, which I don't know if those are around now anymore, but I was on covers of magazines myself. But that's the best that individual looks at that certain time, but they feel the worst. They're over tan and lubed up and everything. And so that is not maintainable, to get back to the point. So it's really interesting that you are trying to look for something that you can actually maintain, and people aren't going to be walking around at 2-3% body fat. It's just not going to happen.
No, and you make a good point. When even people who aren't fitness models, when they get to that level, that's when they're booking the photo shoots. That's when they're posting the Instagram pictures.
Right.
So yeah, I take the approach of, let's help you through my research. Let's help you get your best physique, the leanest you can be, but still allowing you to take your kids to school, to have a night out to eat. So you might not be what we would call peeled or ripped, but you look really good and in a manner that allows you to live your life.
You work with a lot of bodybuilders and physique competitors as well. So you're working with people that take things to the absolute extreme. I mean, if you told a bodybuilder to probably drink their own urine, it's going to make them look so much better. The reason that's in my head is because I had a guy that's drinking his own urine for my podcast. But if tell him that he drank, check out the Certified Health Nut. That was a crazy podcast. If you tell him to drink your own urine and you look 0.5% better next to that guy on stage, they'd probably do it.
Yes, absolutely. And you make a good point. I do study bodybuilders,
Mm-hmm.
and I really have a good relationship with a lot of the top bodybuilding coaches in the world, because they are the ones who have mastered the art of getting lean.
Mm-hmm.
And I study that. Now, they're a couple years ahead of me. My research is always validating what they're doing now.
Yep.
Or what they've been doing. So I learn from bodybuilders. And then I also, like I said, I bring in the maintainable aspect to this. So typically a bodybuilder they'll resistance train 6 days per week. They'll have 1, sometimes 2 cardio sessions per day, and will be in a caloric deficit for up to 24 weeks, which is half the year.
Wow.
Normal people aren't going to do all of those things.
Bodybuilders are not normal. And I don't think any bodybuilder listening to this podcast would be like, no, they're not normal. I mean, when I was doing competitions, it was more like the fitness modeling. I'm 6'3", and most bodybuilders aren't that tall. So I wasn't a bodybuilder. I was doing the physique, if you will. But for a year and a half, I was competing in 3 different competitions, and they were natural. Let's just say there were some people that were definitely not natural, but they weren't testing. So what are you going to do, right? And my wife is like, this is like you being a baby. Like you're eating every 2 hours. You're doing this. You got to make sure you hit the gym. Then 12 weeks out, I'm cutting down and doing all this cardio. And if anybody hasn't ever seen what a bodybuilder goes through, and not to say those people aren't athletes, those guys and females are just some of the most dedicated individuals I've ever seen in my entire life. They're superhuman. It's crazy.
Yeah, absolutely. I have a lot of respect for bikini competitors, male bodybuilders, figure competitors. Yeah, it's like unlike a sport athlete, they're fighting hunger,
right?
Hour after hour after hour, low energy, still going to the gym. That's what I admire. Yep. What is not admirable sometimes is the narcissistic approach that it demands. So if you have children and you're trying to live that lifestyle, it's very difficult to achieve and to maintain that pursuit and raise children. It's difficult.
Yeah, I mean, I could see that. I mean, obviously, and then also from, you know, raising a kid. I mean, we're both fathers, and raising a kid, you want them to be, you know, better people and just be aware of everybody around you. But then if you see your parent like so focused on exactly how they look all the time, like that's got to be an interesting juxtaposition on how you handle that. You know, like if you've got a young boy or young girl and they're overweight and they see mommy or daddy like ripped all the time and worried about the way they look, I'm sure that's, you know, that's for a different podcast, but I can see how that's pretty difficult to try to juggle all that.